Good day, everyone. I'm Maisa Sami Ahmed Al-Noor, medical student in Imperial University College, course Rural Residency, Med 472, Group 2, Batch 18. Today, I will present our research on maternal health services in rural Sudan. On study focused on understanding the current condition of maternal health services, the major barriers women face, and the key factors that affect maternal health outcomes, especially in rural and conflict-affected areas. Maternal health services include antenatal care, birth attendance, emergency obstetric care, and postnatal care. Those services are essential for protecting the lives of mothers and the newborns. However, in Sudan, the lives of mothers and newborns, especially in rural areas, access to these services remains limited, and maternal health continues to be a major public health issue. The main idea of our research was to assess women's knowledge, attitude, and practices regarding maternal health services in rural Sudan. We also aim to explore how poverty, distance, cultural belief, weak infrastructure, and ongoing conflict affect women users of these services. Our research problem was based on the fact that maternal mortality and maternal complication remain high in rural Sudan. While many of these outcomes are preventable with early care and skilled medical support, despite this, many rural women still do not receive regular antenatal care, do not deliver health facilities, and may not receive postnatal follow-up. The study shows continuum of maternal care. First, antenatal care is important for detecting complications such as anemia, hypertension, gestational diabetes, and infections. Second, skilled birth attendance is necessary to manage labor safely and reduce the risk of maternal and neonatal death. Third, postnatal care is important because many complications happen in the first days after birth. Findings show several important results. Maternal health services are unequally distributed in both, in urban and rural areas. Urban areas generally have better access to skilled staff, equipment, and healthcare facilities, while rural communities often suffer from shortages of doctors, midwives, medicine, electricity, clean water, and transportation. Who understand the importance of antenatal care recognize danger signs such as severe bleeding, headache, swelling, or prolonged labor are more likely to seek care early. However, knowledge alone is not enough. Third, many structural barriers prevent women from using services, even when they know they are important. These barriers include poverty, long travel distance, poor roads, lack of ambulance, insecurity, and the cost of treatment and transportation. In some cases, women also face delays because of decisions made by their family or husbands. Fourth, cultural beliefs. And the trust in traditional birth attendance still influence maternal practices in rural areas. Many women prefer home delivery because it feels more familiar, more private, and less expensive. Some women also avoid health facilities because of fear of mistreatment, lack of female staff, or previous negative experience. Important result from our research is the impact of the ongoing conflict on maternal health services. The ongoing conflict in Sudan has damaged health facilities, disrupted supply chains, displaced health workers, and weakened referral systems. As a result, many rural women are unable to access regular maternal care or emergency obstetric services with complications occur. In discussing these results, we found that three delays model helps explain the problem clearly. The first delay is the delay deciding and reaching a health facility. The third delay is the delay in receiving proper care after arrival in rural Sudan. All three delays are present and contributing significantly to poor maternal outcomes. The study also showed that primary healthcare on rural hospitals play an essential role in reducing maternal mortality. When healthcare facilities are staffed, supplied, and functional, they can identify high-risk pregnancy early, provide skilled delivery care, and stabilize women before referral. But when staffing and supplies are weak, preventable complications can become fatal. In conclusion, our research found that maternal health in rural Sudan is affected by a combination of medical, social, economic, cultural, and political factors. Improving maternal health requires more than just increasing awareness. It also requires strengthening healthcare infrastructure, expanding communities and mobile services, improving referral and transportation systems, training and retaining skilled health workers, and reducing financial barriers. Finally, we recommend strengthening maternal services facilities, expanding community-based education, supporting midwives and rural health workers, and improving access to quality care for women in remote and conflict-affected areas. Thank you.